Hi, it's Leah here to tell you about Dr. Anthony Pannozzo. He's a pain specialist located in southern Palm Beach County. So if you are somebody that you know is suffering in pain, Dr. Pannozzo is the one you guys need to call. And make that call today because living in pain is no way to go through life. Dr. Pannozzo has been in practice now for more than 49 years. He's treated more than 73,000 patients for pain. He's an expert when it comes to diagnosing the pain, and he has had huge turnarounds. In fact, people living with scoliosis, he has had nearly a 100% turnaround. Lumbar pain as well. If you've got lower back pain, if you're suffering with migraines or flat feet pain, maybe pain in your elbows, your neck, your shoulders, Dr. Pannozzo can help you. And the greatest thing is he can help you without drugs, without surgery, and without having to go through weeks and months of rehabilitation. Give him a call today, set up an appointment. It's 561-381-5800. Tune into his show Sundays, 11 to noon. And now, here's this week's edition of the Dr. Pannozzo Sports and Medicine Hour.
Good morning, everybody, and welcome to another Sunday with the fabulous Dr. Anthony Pannozzo. Hey, Doc, how you doing?
Okay. Thanks.
Take a shot, you'll be better. Okay. I'm also here with the beautiful and lovely Linda, who we haven't seen in a long time. Hi, Linda.
Hi, Les.
That's all.
Hi, Dr. Pannozzo.
And we have Carol at the board. Hi, baby. And we have the fabulous Gio and his crew and Freddy S. How you doing, Freddy?
Hey, good morning, Les.
Good morning, buddy. So, Doc, every time I read an article in a magazine, I always see things that you have told everybody. I just got the latest Consumer Report magazine, and the whole thing was on pain, believe it or not. And it said that over $300 million are spent on everything from emu oil to getting your toe fixed over at an acupuncturist, and they're saying that doesn't work. And you know why they're saying it doesn't work? Here's what they said. If you go to the doctor for pain, the first thing you want that doctor is to let you know how that pain happened. Did it happen from bending down? And then he wants to know how it happened and where the pain is and how did you get that pain. Where did we hear that? Did anyone know where we heard that from? Freddie?
What?
Where did we hear about that? Dr. Pannozzo, right?
Yes.
Okay. What was the cause of the pain, and what effects do the meds have that this pain specialist is giving you that affect what you're currently taking?
It has no effect.
Okay.
It just makes you a drug addict, that's all.
We know somebody that's...
As a matter of fact, we've been saying, we don't prescribe anything at all.
Right.
Aspirin's your best drug. And now even the FDA is saying you don't prescribe more than 6 days worth
Of aspirin?
of narcotics.
Oh, yeah, right.
So, and I'm saying you don't need narcotics at all for
Right.
pain in the musculoskeletal at all. You don't need it.
Why?
Aspirin's your best drug because they're not anti-inflammatory. Aspirin is anti-inflammatory or a steroid. So that's what you should be taking, not narcotics, nothing that'll bother your brain at all.
I'm having some trouble here with... Are you? It's very foggy. Oh, you having trouble, Doc? Is it sound
Nope.
foggy? Oh, it must be me
Testing
then.
1, 2, 3.
Hello? Space
Back.
Station X. Okay.
It's back. It's back.
Okay.
It was out. It left and came back.
So anyway, they're trying to catch up to us on the things we've been talking about.
But isn't it amazing that everything that you have said over the years has
It's
come
true.
to fruition?
Oh yeah.
I mean, think about that. Everything you said. So why?
But they're still doing dumb things. Like,
Right.
for instance, pain management for the Main Street practitioner.
But that's pain
You see
management.
that?
There's a difference.
Well, pain management, they're trying to treat pain problems, but
Right.
they don't know how because they're managing pain. English is important.
Yes.
Somebody says, I'm going to manage you. They're not really serious about it. You have to get rid of it, not manage it. Anyway, this whole thing is based on narcotics. The whole thing, the whole conference that this is.
Well,
It's wrong. There's no reason to have narcotics. You need a source of a pain, then you be able to treat it. If you don't know where the source is, you're going to hide it or cover it up, or get an MRI, anything to waste time.
that's just what they said in the magazine, that
Yeah.
before anyone could tell I could fix that, they have to find out what the source of that pain was. How do you fix something if you don't know where the source is coming?
Well, they're not, and the whole thing is a scam. I mean, in my mind, anyway. I mean.
Well, we met a...
I mean, they're trying to help you, but
Yeah.
I'm not saying they're not trying to help you, but I'm saying if you go to a doctor and you say, I have a pain, and he says, well, let's get an MRI, that is not the kind of guy you want to go to. You want to go to somebody else who knows how to ask questions. How'd you get this? How long is it? Where does it go? Is it referred into your leg? Is it in your arm? You have a headache with it? You have to know all kinds of stuff. So every question we ask in our offices is based on a anatomy.
Mm-hmm.
In other words, if I ask you if you're low back pain, do you have pain when you bend? Well, that is a structure. We know where that is. And if it goes in the leg, we know what causes that. So every question we ask is based on the anatomy causing a pain. And that's how you have to do it that way. And then we do special film that tells us the engineering aspect of the thing. How do you bear weight? Because back pain is a failure to bear weight. You have to think of it in those terms. And then we have a diagnosis there, and then we call a scenario where we tell you what happened to you, why you have it, where it is, what we can do for it, and then we actually do it. So, and then after that, you get pain relief, and it's virtually 100% for low back pain.
Well, you know what's funny?
And headaches.
You know what's funny is when you talk to orthopedic surgeons, which they're surgeons, they say why. I ask them why. In some cases, do the problems come back when someone has a knee operation, and they said scar tissue. I said, so let me ask you another stupid question. If we know where the source is coming of the scar tissue, why don't we work in conjunction with Dr. Anthony Pannozzo who'll get rid of the scar tissue? It'll be a win-win for everybody.
Yeah.
Well, in fact, Freddy, remember that stem cell guy we met?
Right.
He said a lot of patients suffer from scar tissue, and he'd love to work with you.
Right.
He was smart.
They can't relieve the scar tissue.
Yeah, he was very smart. This guy actually believed that what you do can really help his patients after what he does.
Yeah.
Right.
So
Well,
there's a smart doctor.
More and more will consider what we're talking about as truth. They have to change their methods. We can't stop these huge bills, everybody getting a knee replacement,
Right.
if they don't buy into this. The knees are kind of simple to treat, actually. The construction is rather simple. The pain is always outside of the knee, not inside. So you have to know that. People are going to look at me and say, is he talking about, my doctor says I have this cartilage? No, you don't.
Bone on bone, ACL.
You have a capsulitis is what you have.
Ooh.
And that's the only place that's painful in the knee.
Capsulitis.
They actually agreed with you.
Yeah.
And they said there's no way of tearing the ligament.
Yeah.
It
Who
may
agrees?
tear off the guys that were here. They said it may tear off the bone, but they have procedures now where you don't have to perform surgery. And
Well, I remember a couple of years ago, the basketball player for the Phoenix
for the sun.
team. Remember that guy? They put screws every
That's right.
couple of centimeters around the whole thing.
That's just bad medicine.
bad.
And, it's really funny that you guys are talking about meds, because the Miami Marlins, Gordon, who led the baseball and batting last year,
Excuse me.
was just suspended 80 games
Yes,
for PEDs. And from what I was reading,
80 games. I heard that.
80 games. And there are many types of PEDs, I guess, that they take.
What's a PED anyway?
I don't know. I was going to ask you. You're the doctor.
Yeah, what is a PED?
I don't know. What is it?
I have no idea.
They named
Oh, wait,
it.
we have someone that knows. What's PED?
Performance enhancement drug.
That's the girl.
Performance enhancement.
Doc, this girl, let me tell you about this lady. We try to stump her every day because she's a board operator. We haven't stumped her yet. Whenever you ask, she has the answer.
But one of the
Well, come and sit over here.
Yeah, take my job. Let me go in there.
well, there are multiple things, and the baseball players keep saying, I don't know how it got in my body. I don't know how it got in my body. So they found out that one of the PEDs that you can get suspended for is actually in medicine that women put in their bodies to prevent pregnancies. And when you have sex with a woman, you can actually get contaminated with that PED.
Oh, I don't have anything to worry about. I haven't had sex in a while.
I've never heard of that.
Yeah, I just read it.
It's kind of far-fetched.
No, it's not far-fetched. And now they're looking into it
Now
because...
look, how in the world, if someone is taking that, just think about this, and they're taking a normal dose, which happens to be in your blood for a certain amount of time, how do you get it from that person's bloodstream into yours? How do you do that?
I don't know, Doc.
You can't do it. There's no way to do it.
All I
see?
know is that they have evidence that
Great
it has
penetration, buddy.
No, they're lying. Is what it. They're
Well,
not.
the PED is showing up in the ball player's bloodstream.
Yes. Well, I'll tell you what happened. I listened to that whole story. Defoe was doing it, and if you could get rid of some of the stuff that he says, you can understand it. What they said is he used to go to I can mention the names of the companies because they did. General Nutrition Center he used to buy this big jug of protein, and inside one of the things was PED, performance enhancement drug,
Inside the powder.
inside the powder.
Well, you can't take it then.
Right, but he didn't know. So then, when he found out what it was, he ordered it from China. So here's what Defoe said. He said, "Hey, $21 to get it from China, and guess what? You just lost $100 million."
That's what happens.
Yeah, but China will send anything
I
on
mean,
the
you
internet.
could prove positive taking seeded bagel,
Yeah. I said, no, sesame seed bagel.
sesame seed bagel.
Oh no, I'm sorry, poppy seed. Poppy seed
Yeah,
bagel.
you could prove positive for PED because it's the same ingredient.
No,
I'm going to tell you that I think you're wrong on this one,
no, I'm not.
because poppy is what is a derivative
There's
of a
not
drug.
enough there. There's not enough there.
Well, if you eat a lot of poppy seeds bagels and
Well, how much you have to eat? A truckload a
A
day?
truckload a day.
No.
What was that?
You're thinking of Seinfeld. You're thinking of the Seinfeld.
Seinfeld episode.
No,
right.
no. I'm telling you that I read
With
this
Elaine.
and I did
Yes.
research on it because of this sexual activity. You can get a PED from a woman's.
Hoo-ha.
You're thinking
Nah,
of,
not the hoo-ha. Whatever she uses to not get pregnant.
You're thinking of STD.
STD.
No, no,
He's
no.
right.
Listen, I know the
STD.
difference between
No, no,
STD
no.
and PED.
It's progest. Here's what it is: progesterone.
Progesterone.
That's what they take. Progesterone.
Oh, I don't know what they take, but I
Yeah,
know that it's
to
a.
prevent pregnancy.
All right, you want me to look up? I'll look
and
up
you
the article.
cannot get it from intercourse or anything else.
I'm
It doesn't-
gonna look up the article.
No, these players are lying. They're taking their wife's medication just to get it.
So you could take a medication that
You
that
can
your
get
wife takes.
progesterone by itself. Yeah, take it.
So progesterone is used mainly to instead of birth control pills, they would take that. And,
You
so they would
prevent
get,
pregnancy. Progesterone. Yeah.
huh? Wow. Wish I would have known that when I was single.
Why? You gonna get pregnant?
No, why
You
not?
don't get pregnant.
You
Where
don't
is
even
it?
have sex.
Before I got married, I did.
Oh, that's true. Can't argue with that. Can't argue with that.
We don't want to know those
I
sort
know.
of details.
Thank you, Doc.
I have a joke if you want to hear it, Doc.
No.
Okay.
Read the
Read
question.
the questions. I knew I was made for that one, Freddie. Freddie's gonna look up and show you that. Freddie's determined to show you something. Hey, Doc. Johnny from New York City writes. My knees hurt at night, and I sprained it once before. Doctors give me pain pills for the injury, but the knee still feels the same. I have stiffness at night. I wrap it in an ace bandage, which seems to help. I do not want to go down the path of pain pills and surgery. That is out of the question. My question is, with a little information I'm sharing with you, can you fix my knee with medicine, and will the pain of the knee return? I've been this way for 2 years.
He's not describing a knee here. I don't know what he's got.
Okay.
Okay. But if it's a knee, we can fix it in a matter of days. It's
Right.
not a big deal.
So you know what? The weather in New York is pretty bad right now, right?
No, actually, it's nice now.
60 degrees.
So, Johnny, why don't you come down from New York, take a nice flight out, or else just call Dr. Pannozzo direct, not now, after the show is over, at 561-381-5800. 561-381-5800. Your success rate with knees are like unbelievable.
They're virtually very high. Everything we treat is very high now. Very
Well,
high.
Saturday, I went to the gym, and there's our boy, Jim. Hey, Wes. I said, what happened? Saw Dr. Pannozzo. He got a shot. He was so happy.
Well, he had all that scar tissue.
Oh, he's got, whoa.
Yeah, remember, if your knee is painful after surgery, it's not because you need another knee surgery.
Right.
You need scar tissue treated, and we do that.
So here's my...
Now, the orthopedic surgeons don't waste time doing that. See,
Right.
to them, that's a low cost item, and they want to be in the operating room.
So here's my word to all
So
you.
who does the post-op physical therapy? And do they have it? Ability to do it? No, they do not.
You can't get rid of the scar tissue with
They
physical
don't
therapy.
have it, and you shouldn't waste time with that.
So let me ask you a stupid question, and I'm asking this to anyone that's listening.
No stupid questions are allowed.
Why wouldn't an orthopedic surgeon work with you to prevent that scar tissue and get rid of that scar tissue so they could be a normal person again.
If I could put my mind inside of the mind of an orthopedic surgeon, I'd do it. I have no idea.
I think Johnny wants you. Is that Johnny from New York?
We'll call you back.
We'll call you right back.
We'll call you right
as
back.
soon as the end of the show's out.
Okay.
And they won't do it because obviously there won't be a surgery.
No,
I mean, that's obvious.
Yeah, but if a doctor does a surgery of anything,
Yeah.
and it causes scar tissue, the doctor he can't do another knee replacement of the same knee. So by having Dr. Pannozzo work as a team.
Oh, you mean after the surgery?
Yeah, to get rid of that scar
But
tissue.
they don't think that way. They think they're
I'm not
very.
even a doctor. I can
all right,
think
I'm
that.
trying to explain it to you. They're very protective of. They're very protective of their profession.
I love this guy.
They're not going to dilute it by having another doctor interfere with them.
That's right.
I'm sorry. I
And
said
it's
that.
all based on ego. I mean, there's no science there. I mean, it's an ego.
But you all took the Hippocrates Oath. You're supposed to take care of a patient.
Well, talk to them about it.
I
all right?
did.
Oh, you did.
Yeah.
What happened?
What happened?
One guy that we met from Tenet said the same thing. He said, you know what, that would be a good idea. And he said, why don't you have Dr. Pannozzo meet with the person from Tenet, because it could be a great thing for everybody.
Well, there are a couple of things wrong there. First of all, the physical therapist is going to get really upset. And so if they do that, the administration has a problem.
But Tenet is a very good hospital, and they run that hospital like unbelievable, and they want to help people.
Well, the physical therapists still have a play. I mean, they can get you in shape.
To do what?
Yell at him now.
I don't know, Doc. I'm just trying to make it so they won't get upset.
I mean, Harry, I can't have you on the show because you're a physical therapist. Go somewhere else. Well, I mean, like Freddy said, is a physical therapist good for something? I mean, honestly.
Well, I don't know what they're good for. 'Cause,
Okay.
They're not. It's a trade school. They're not trained well, and they're given too much responsibility by the orthopedic surgeon. And I've said this for years and years and years, and you can't get in there. This is what happens to the professional ball teams. When you have a $50 million player who's sitting on a bench for 3 weeks, you got a problem there.
Well, I've seen guys that sat on a bench for 4 weeks with a groin injury. My God, I was done in an hour.
I know. I don't.
An hour, I was too slow.
I don't even.
Well, first it
there's no
took you
logic
20
there.
minutes to find out where it was. Then you stuck that magic thumb in my woo.
But there's no logic when you have a ball player sitting on the bench.
No,
Is this the thumb you're talking about?
no, that thumb, Doc.
Oh,
the
this
big one. The big one.
Okay, this is the one.
Yeah.
And what about David Wright's spinal stenosis, which Dr. Pannozzo says is, it's just he can't move. I'm
Who?
sorry, David Wright. He just can't. He can't throw the ball. He looks like a stiff board because he has to throw the ball a certain way. So everybody's bunting on him, little dribblers. He can't. He can't make the play anymore.
What about Steph Curry? Was that a hip injury? What did he have?
I heard.
How can these guys go to work? These professionals. How can they go to work and have a player doing that? How can they?
And they've been treating him for over a year.
Wow. Like I said, 2 treatments. If
Well,
you're
the
not
Tiger-
better than 2 treatments, you're in the wrong place.
Tiger Woods is coming back. Did
Really?
you see it in the
No,
news?
no.
Yeah, he announced he's in the Australian Open.
He's not going to make it.
Let me tell you something about Tiger Woods. I'll say this is,
I know about scar tissue,
If it
and
wasn't-
he still has it.
if it wasn't for, this is like our
What
Two
was the
Boys
joke?
from Brooklyn show.
What is the joke, Linda?
Because when you say,
What?
when you
He's
say
not gonna
something,
make it.
you ain't gonna make it. We all start laughing.
Why?
Tiger Woods, you're not gonna make it, Tiger.
Dr. Pannozzo.
Because he has scar tissue yet.
I think
And
his
as
son.
soon as he gets under pressure, it's going to bother him. He's going to have a bad performance, so he's going to walk off.
You want
Well,
to-
anyway, that's my prediction. I've been wrong before, but not often.
You want to talk? Do you want to talk to your son?
No.
Okay. So let's go on with the show then. You
Go
ready?
ahead. Go ahead.
Gotta put him on.
Hey, Dr. P, young one, how you doing?
Very well. How are you this
Everything
morning?
going good? Poor Johnny, I haven't heard from you in so long.
Well, it's hard with the time change. It's like so early.
Did your wife make you
Over
get
here.
up and clean the house?
What's that?
Did your wife make you get up and clean the house?
Yeah, the sun's been coming up. Comes up really early now. So
What time is it then?
3 hour difference, right?
yeah, it's after 8, so it's fine.
So today we're talking about scar tissue and everything else.
Yeah.
So Doc, ask your son. Well,
You'll have a presentation. Go ahead, Paul.
Oh, about scar tissue?
Well, I spoke to an orthopedic surgeon who was a very honest orthopedic surgeon, and I told him what Dr. Pannozzo did, and he said that you should get him up here to talk to the big guys, because if there's scar tissue, we can't get rid of it, but he can.
Yeah.
So, what do you do then?
Yeah. Well, steroids, as one of their functions, one of the things they do is they break down collagen.
Mm-hmm.
And collagen is what makes up scar. So if you were to inject some steroid underneath a scar, it can help, it can help break it down and soften it. And we do that quite a bit.
Yep.
I got a question for you, Doc.
Which one?
The son.
Son, Paul.
Paul, PEDs. You heard of PEDs?
Yes.
Okay, you know what they are, right?
Yes.
There's a whole bunch of them, correct?
Yes.
There's one in particular that's found in women medicine so they don't get pregnant. And ball players, if they have sex with these women, they get contaminated and they end up proving positive for that PED. Did you hear that story?
No, I did not. But I doubt that story. There's no way you're going to get any kind of level like that.
Especially when they use a condom, right, Paul?
Where'd you read that in Mad Magazine?
ESPN.
ESPN. Wow.
ESPN.
Yeah, well, who said they were using a
Oh,
condom?
did you hear about Sal? What's his name? Sal that died from a brain, something in his brain. I read that. They're blaming it on concussions, which is wrong. The guy had a brain disease. People do that, not from being hit in the football field.
Yeah, Ken Stabler's wife is also suing the NFL now over that concussion.
Kane the Snake.
They have to lose, right, Paul?
People get chronic brain injury. Think of all the boxers.
Yeah, that's what I understand.
Muhammad Ali. I mean, or all those boxers who that some of them they over the years they don't carry on a conversation too well.
Paul, what I've noticed when I was watching the fights last night on Showtime, those guys' necks snap so viciously when they get hit, which is gotta be doing something to the brain. I mean, there's no way you could get that thing. I think that's worse than football. I mean, they're getting hit in the head.
Most definitely.
Right? Yeah.
I would never have a child of mine go into boxing.
Oh God, no.
That's an ancient sport when there was nothing else to do and when you didn't live beyond 30 or 40 years of age, right?
Right,
so
didn't matter.
There is no reason to continue that today, in my opinion. I have no interest in boxing whatsoever.
Well, it's amazing.
But you see, they can test for that. They have special tests. What are those special tests, Paul? They have CAT scan and the PET scan.
Are you okay with those?
Those are
CT
tests.
and MRI can look at the anatomy, and neuropsych testing can assess the way your executive functions. The way you're able to plan,
right,
and things like that. But
we don't see that much.
Once you have the damage, you can't reverse it.
But we don't see that much. I mean, there's no articles on that saying that you can definitely find brain damage. So most of it's referred from the neck. Vertigo, migraine, all that's from the neck.
Yeah, your dad was talking about that. And then
I'm talking about cognitive decline, which you can see on testing, and you can see you can see the anatomic findings on CT, MRI.
Yes, if you can see it, then you
brain tissue is damaged. That's cognitive.
But that's not.
Then you'll get cognitive decline.
But it's not the real thing. You don't see it all the time on everybody. Usually, it's not that way at all.
Really?
Yeah.
Can you as a boxer, injure that part of the spine more and more and more, even because you're getting hit
It's
in the
not the
head?
spine. It's
the neck?
Ligament structure.
Holding the head. Okay. So you can injure that more and more as you're boxing.
Yeah, you could do it on automobile accident, football field. You could fall down the steps and do it. There's all kinds of ways to get it.
But when you did it, I mean, this guy got hit so hard, his head went back. I said he's going to have a migraine afterwards.
Yeah.
He's going to have a bad headache, and then down the road, he's going to have
he's going to have a bad day.
He's going to have a chronic brain injury. It's just dumb.
You know, Paul, what you said is so. When they interview a lot of these guys that have been doing it for a long time, they have trouble talking.
Yes.
Yeah, I mean,
You
can,
bet.
they can't understand.
But you don't know what they were like before that.
I would imagine.
That's true. It's a true point.
Yeah, but wait a second. Would they let you fight if you were? I guess if you were good, they'd let you fight. The only fighter I've seen that talks normal and is intelligent, you know who it is? Danny Garcia.
No, what about what's the sweet thing? Whatever his name is.
Sugar Ray Leonard?
He's one.
Yep.
He still talks clearly.
And so is Mayweather. You know why?
Mayweather's because
they never get hit.
And then the white kid, what's his name? The Latino guy. He's big in the fighting business. And I can't remember his name. But those guys walked away, and they still speak sort of okay.
Because they were I mean, those guys never get hit. I mean, if you ever watch a Floyd Mayweather fight, he very seldom gets hit.
Joe Frazier, you can't understand a word he says.
Oh gosh,
he sounds like he's mumbling.
How about Larry Holmes?
Larry who?
Larry. This is Larry Holmes talking.
No, he's kind of clear. He has the Larry grill.
I gotta put the phone.
What does Muhammad Ali have, Paul?
Parkinson's.
Parkinson's.
It's Parkinson's. Yeah.
Well, my brother has Parkinson's, and he's
Paul,
never been in.
I want to ask Paul
he's
you a
never
question.
boxed. He was always a manager.
Can you actually get Parkinson's disease with getting hit in the head that many times?
I don't think so.
I don't think so.
I don't really know that answer.
No,
But I wouldn't.
Well,
think
we would
you
know
get
that if it
Parkinson's
was
from that.
prominent. See, he's saying he doesn't know because he doesn't know. Really, it's not evident in our teachings and our readings.
It's not what we
It's
teach.
not there.
right.
Well, you get too many people who aren't boxers that have Parkinson's.
Yeah,
There's
Yes,
too many
that's
boxers
exactly what I said.
Because
that don't have Parkinson's. So I don't think there's a solid relationship there. But I don't know that answer. I'm not a neurologist but I don't think that's true.
I think it didn't help him getting hit in the head, and he did the
rope-a-dope.
The rope-a-dope.
He just sat there.
He got hit a lot, Doc.
He just sat there like this, tiring out boxers.
No, see, your reasoning is not accurate.
Well, we don't
He
know.
was going to have that anyway.
No, I understand that, but I'm pretty sure getting hit in the
He
head
was
200
never
times a day.
beat up in boxing, Ali. He was always beating someone. That's why he
What
wants
the
it.
rope-a-dope was when he took all his punishment. He started doing that the second part of his career.
Yeah.
Yeah, but see, you can set your body to take a stress like that.
Really?
Yeah, if you know you're going to be hit in the stomach, you tighten your stomach muscles up.
Yeah,
You ever
but
see these guys get hit in the stomach? It doesn't bother them. You hit me like that, I'm dead.
Frazier broke his jaw, Doc. I don't
Yeah.
think he was waiting for that kind of pain.
Well, Frazier
Broke his
was an
jaw.
animal.
Yeah, he was.
He was like a train when he hit you.
He was a train coming at you.
You never see a lot of Jewish boxers, do you?
No, Jewish guys, they're
Jewish
the ones.
guys don't
They're the
fight.
ones in the corner.
No, the
Those are
Jewish
little
guys.
shrimps, that's why.
The Jewish. Hey, be quiet, Italian guy.
They're,
Hey, Paul,
they're the corner guys.
You see what I have to go through every week with your father?
Pardon me?
You see what I go through with your father every week?
It seems like a lot of fun.
Yes, it is. Well, we got to get you on your own show.
Right.
I know.
Right.
He's knowledgeable. He
Oh,
knows
he's
a lot of
very,
stuff.
very smart. Because you know what it is? He has all the modern things that a lot of doctors didn't have when they were growing up. I mean, he's got modern ways of doing things. Paul, let me ask you a question. How many migraines do you see on a daily basis?
Well, we don't accept that word. So, how many headaches do people with headaches do we see on a daily basis?
He's good, this one. How many headaches, Paul? I'm sorry.
Perhaps. Well, it seems like everyone has a headache anymore, whether it be their life or what. But
No, he's Paul. He's talking about COC1.
Yeah,
migraine.
COC1. I am? Oh, I know I was that smart. COC1.
Every day we see it. Several people. I see more headache from C2-3 and 3-4 than OA joint, than the highest joint, the OA joint, COC1. But every day, people, and
He's funny.
headache, chronic headache, where people that say, "Oh, I have headache for years." I mean, all this is, there are many people out there, unfortunately, that have that.
Hey, I got an idea, Doc. How about if I read a question and you and your son could decide what...
Read a question. Yes, good idea.
Hey, Paul, I used to have control of this show, but I really don't. It's a good thing I have my glasses here today, Freddie.
Let's read a question.
I am Freddie. Maggie from New York City writes, I've seen your last show and was amazed about the subject of, I can't say it, migraine headaches. You spoke about it. It's CO2, right? CO2?
No, CO2 is carbon dioxide.
Oh, shit. Okay.
That's what I was laughing. I knew you were going to say that. I knew it.
I have terrible migraines to the point that my doctor has given me medication to cope with it. But I find that the medicine makes me depressed and unable to function normally. I want to fly down to see you and wanted to make sure I can get an appointment with no problem. What do you feel about medication given to cure this pain?
Migraine?
Mm-hmm.
You know, there's a girl here at iHeart that is suffering from depression as well over the medicine they gave
She
her.
works at iHeart.
No, the medicine they gave her for migraines. So she stopped taking the pills. It was making her depressed.
Oh, I know
Yeah,
that.
aspirin is your best drug. Remember, it's an inflammation of a joint. That's what it is.
I think people should stop taking pills altogether.
Oh,
There's
God,
too
yes.
many pills
Well,
going on.
aspirin's very good for you, and it has a lot of good effects, and it does take pain down. So that's what you want. Nothing else.
Well,
None of these other drugs for headaches should be taken. I'm going to tell you, neurologists, quit doing that. Aspirin's your best drug.
well, I'll tell you one thing, Paul. I have Crohn's disease, so I have to be very careful what I take. And I said to my gastro guy, "What should I take if I have pain?" He said, "Take aspirin." I said, "Won't aspirin affect me with my Crohn's disease?" He said, "Let's see, if you swallow 2 bottles, maybe you'll have, but 2 or 3
Yeah,
aspirins."
it's dose related.
He said, "What's more dangerous and people don't realize is Tylenol. There's a
Yeah.
label on Tylenol that says you could die if you overdose on Tylenol."
There's a label on everything you take. You
Now,
could
why
die.
do you think people are taking Tylenol?
I don't know.
Because it was
Advertising.
advertising.
Billions of dollars a year were spent in advertising. They made a market out of nothing.
That's why I made so much money advertising you.
That's why I'm probably sick, Doc. Because
Read
I
a
took,
question.
I
Read a
took,
question.
I took more Tylenol
This
than I
guy's
can
off the
remember.
he's off the rails today. What is wrong?
What
Okay.
rails?
What rails?
Okay, Leach from New York City writes, "I am a musician by trade and my migraines seem to come late at night when I'm performing. Needless to say, that isn't the best time. I am a trumpet player. I wanted to know if by playing the trumpet, I've done this for over 13 years and never had a problem before. My wife tells me that the problem can't be playing the instrument. It must be something in my body producing these pains, and I wanted to know your opinion."
What is the problem?
Smart lady.
Migraine.
Yeah, migraines.
Well,
migraine.
Yeah, terrific migraines.
Well, it's because the way he holds his trumpet up.
oh, really?
Yeah, sure.
13 years, it finally caught up to him.
No, it's been coming on, and I'm sure he's been taking care of it.
Wow, you know, that's unbelievable. And Paul, what do you think about
Yeah,
that?
because they're holding the trumpet up. He's right.
The musician probably did something to hurt himself a little bit with
Yeah.
his neck, didn't maybe realize it. Then the positioning of the neck here, he's looking down, reading music,
Now, remember when you're...
or the way he's holding it, it causes the pain. A personal problem I have is when I'm on the airplane, and for all those hours, I'm either looking down, reading something, or looking down, doing a crossword puzzle, or looking down. I come out of the airplane with a tremendous headache.
Oh,
All the time. I hate
Same thing with
flying
me.
because of that.
Same
thing with
My
me.
head up.
Why don't you come into Delray and we'll give you a shot? We'll take you.
I know.
Paul, I didn't realize what you just said is so
Dude, I'm
true.
not flying there if I'm flying.
Yeah, I hate
Fly-
flying for that reason. But
Oh, yeah, he is coming down here to go on a ship. Yeah.
Oh, good. So you could be on the show
could you come on to the show before, that day?
before you leave,
Before you leave, come on, we'll have both of you here talking.
or when you get back.
Oh yeah, no, I wish I have these airline tickets already, and the airline industry has gone downhill.
You think?
Especially all these mergers that have been allowed to happen. There's very lot less choice now than there used to be.
I know.
And, get pigeonholed into these flights that are available. It's terrible.
What your son said was so true. I didn't realize it. When I'm on the plane, like when I went to Vegas, my head was down like this reading my book.
Yeah.
And when I got off the plane, I said, "Oh my God,
Well,
my neck is
also,
I got a headache."
You have a heavy bag and you have to throw it up on there, you can hurt yourself.
Well, you discovered that when you asked me when I had the groin pain. This is why I want people. I said, "Doc, I don't lift anything." He said, and he looks at me and says, "You had to lift something." I said, "Doc, the only thing I remember was taking a bag out of the car and said, 'Oh, okay, where's it hurt you now?' I don't know what." And he started yelling at me. He says, "Okay." He put his finger on my groin and with 2 shots.
I would yell at him.
No, the funny thing is you
I
put
don't
your
think
finger
so.
on his groin.
Oh,
And man, did I yell.
then he yelled.
And Paul, you want to hear something really funny, which I can't understand with these NFL players? That was over a year ago, and I still work out at the gym. I run, I do everything, and I have no pain in my groin. Why do they keep an NFL player out for 4 weeks? That I don't understand.
Orthopedic
I
surgeons.
know. It
Orthopedic
drives us
surgeons.
crazy. And, before I called in, just before I heard that comment that was made, and about, kind of the therapists and trainers and things, and I kind of agree, well, not kind of, I do agree that there is not the right leadership in these teams.
Oh, I agree 100%.
And these athletes they're sitting and they can be rehabilitated much quicker. And most pain is not muscular, where you have to strengthen it or exercise it out. Most of it is connective tissue, tendon or ligament, and the fix is quick. It's easily done, and it's just too bad, mind-boggling. Couldn't believe it.
No, I think is bad. I think that you said about the planes. I think medical care has gone downhill too. I really do. The wrong people doing the wrong things. I really do. I mean.
Yeah. Well, when you go to the doctor now, who do you see? When you go to your doctor's office, do you see a doctor or do you see a PA?
Well, I usually see. Oh, I'll tell you a very funny story about it. You're right.
SP.
I went to the doctor. It was to get my prostate exam, and in comes a PA. Asked me all questions. A girl. I said, "Hey, how you doing, Bubba?" She said, "Bend over." I said, "Not before we go to dinner." I said, "Where's my doctor?" I said, "Where's my doctor?" "Oh, he's busy." He sent me. I says, "I paid to see my doctor."
So let me ask you a question. Why are PAs being used more than doctors? Is it because of the money?
I don't know.
Money, yes.
Yeah, it is
money.
It's because of the money. So
You
the
can-
doctor wants to spend time?
The practice is able to get more people in per day, and the government views them as an equivalent, unfortunately, and it is about the dollars and cents. It's terrible. This is a true story. Friday, I saw a new patient, an older lady, who was at another pain practice in town, and she brought her paperwork. She went there once. She said, "I'm never going back." And I reviewed her chart note, and in there was a nice thank you letter from the practice, signed by the nurse practitioner who saw this patient new for the first time and gave her a prescription and set her up for a procedure, but totally missed cold why she's having her trouble, which was a curve, and she couldn't stand up straight. We put a little medication there, and that was that. I did a little shot, but she was going to have her set up for something totally different. There is no equivalency in physician evaluation and a PA or a nurse practitioner evaluation. There is no equivalency. It is not the same.
No, of course it's not. They're not. You guys go to medical school for 4 years.
The insurance companies are willing to pay for that, so
that's
they
right.
get hired. See, it's all based on the cash flow. So if you can hire someone and get paid for that, then I'll hire you, and you take care of the mundane things, and then I can work less.
Hey, Les, we got a
So
job.
this is what they do. Go
We
ahead.
should get a job with Dr. Pannozzo. I mean,
We should.
we should be
So,
PAs.
what we need to transition this show into is a sports franchise ownership and insurance company control, and also things like that. This because what we say on the show is absolutely the truth.
Oh, it is definitely the truth, because I mean, there's 3 of us here that have gone to see your dad, and we're all better.
Paul's been trained well.
Yes, he has. Hey, did your father have any help you out a little, buddy?
What's that?
Did your dad help you out a little?
Oh, many, many times.
Yeah. Knowing your father has improved the way I look at things. I've seen, I imagine you do the same thing. I have seen such remarkable stuff. I have documentary proof of that, how people are when they walk out of the office. I saw a guy come in one day. He said, "You did my knee." And he said, "Is it okay?" He said, "Yeah, I just want to come and say hello." I mean, they never come back.
He said he just came
They just came and said hello. And I remember the one guy, you said to him, "Oh, you're giving me too much money for the copay." He says, "I don't care." You said, "But and you threw the money over. You didn't want his money. He just didn't want it." It was very.
Yeah, that's a true
I
story.
remember that was very funny.
Yeah.
That was very
I
funny.
heard Jerry Shivers came back in, Doc.
Yeah.
Yeah.
How's he doing?
He's doing great.
Yeah.
He still has any pains? Or he
That
got most of-
that knee is going to be normal in another 3 visits.
Wow.
Jerry Cheevers, you know who that is, Paul? You follow hockey?
I don't. I heard that name, but I don't know who that is.
Yeah, he's a Hall of Fame hockey player. You know, one of the guys, what do they call gold pucks? What do they give that? Like,
He's a Hall of Fame hockey player, and he has 2 Stanley Cup rings. He won
Wow.
on 2 teams.
Wow.
Boston Bruins.
Okay, let's get some more questions here, Doc.
Yes.
Okay. Sally from New York City writes, I am a school teacher in the New York City Board of Education. I'm on my feet at least 10 hours a day. Doing this for over 11 years, my hips and legs seem to be getting beat up pretty bad. The board sends me to their doctors, which I have tired legs, which I would like to know if any of this is true. I have been in pain from my hips to my knees. Interested to see what you think about tired legs. Is there something called tired legs? And what are your thoughts?
Anybody know what that is?
I never heard of
No.
tired legs.
I've heard of it.
No.
No.
I've heard of it.
Never heard of it?
There are commercials in Miami. Doctors have put commercials out saying if you have tired legs, come and see us. But I don't know what that means. What is
Well,
tired legs?
Botox says if you have headaches, come see us.
Yeah,
Tired legs, tired legs I never heard of. Did you?
No, it
Paul?
just doesn't mean anything. You have to be able to take a history and find out what this person means by her tired leg. What does she mean by that? And you have to get the history established so you know what you're talking about.
Right.
But it could be a referred pain from the lower back. It could be. That's just about it. I mean, that would include the hips and the knees and down the leg. But if you take a proper history and do an exam, you can find this out, no problem at all.
Well, the fun is, Paul, I've seen your father when people came in they had ankle problems, and he said it's not your ankle. They had this problem, and he just, well, your son.
Yeah.
He came in, and he gave this one lady, I don't want to keep repeating the story for the 50,000th time, and she didn't have to wear a boot, and she's a very athletic person. She didn't have to wear a boot, and she was fine. So referred pain is a lot of people don't know about referred pain or what they think.
Yeah,
which
this
is very strange.
we do a lot of diagnosis in our specialty. Musculoskeletal. Paul does a lot, and I do a lot. Before you can treat anybody, so when you get fantastic treatment like you had for yourselves, you have to know what you're talking about.
Yeah.
And it's not that easy. And when people want to go, say, to a chiropractor or something, instead of paying what it costs to be diagnosed properly and treated, they're losing it because they're just prolonging their agony. That's all.
I cannot see for the life of me what a chiropractor does. I still don't understand what they do.
Well, you have another question?
I certainly do, Doc. I have a couple more. You want me to hold it?
Before we go to that, Doc, the Board of Education, I think that the interesting part about this question is that the Board of Education, they send you to their own doctors.
That's correct.
Well, it's all based on who knows who.
Gotcha.
Okay.
But
everybody's trained the same. So why do they have to send you to their doctor?
To their doc. That's my
point. I mean, it's craziness. People have to understand they're being used, and they have to insist, I'm going to my doctor, not your doctor. See? Now, when you have that attitude, you have strength behind you, then you make the right decision. Don't let the insurance company tell you what to do. It's your health, not theirs. Those people are sitting in an office, air-conditioned office, and you're out there suffering, and you're supposed to do what they tell you? No.
And you have all those teachers. There got to be over 60,000 strong in New York teachers that are all going to the same family of doctors.
You know why? It's one of the biggest unions out
It's
there.
a huge union. Huge. And what I'm getting at here is that maybe an education towards the Board of Ed doctors, or whoever they may be, should get educated.
I think the unions have such a strong hold on that you can't get them away from into a different group.
Well, I don't want them to do anything different. I just want them to learn that what Dr. Pannozzo is saying.
I think there's a lot of corruption there.
In the unions.
That's what I was going to add. It is a quid pro quo there, corruption at the top. They will make sure people go some places in return for a favor or some kind of reward. I would guarantee that to be true.
That's why I'm voting for Trump.
Right. Well, he's not going to change that. Even in Delray Beach here, people will call me up and they have a workman's comp injury. And I'll say, yes, we can treat what you have, but go to your representative there who's taking care of that, and tell them you want to come to see me, so they'll pay your bill for you.
Mm-hmm.
That's the last you see of them, because they're referred now to a surgeon somewhere, and then they never get back to work. Oh, it's a big corruption. I mean, it's just, and the people are paying a price for that, and all they have to do is insist on the proper care for themselves. They just have to insist on it.
Well, here's a question that Freddie and I get a lot, and here's what I'm going to tell you. Mike from Atlanta writes, I love to listen to your show on Atlanta 1100 and feel that you should open an office here to help us get back on our feet. How many of those do you get every day?
Plenty.
Is that right?
Yeah, he gets it all the time. I had arthritis in my hip for many years and can't seem to get moving around anymore. I'm a veteran for 12 years and haven't found anyone at the VA to help me back on my feet. The amount of medication they give me so much I've stopped taking the pills. It clouds my mind and will not let me think clearly. They say the only other alternative is surgery, and I know how you feel about that. Can arthritis in the hips be cured?
Yes.
Paul?
Yes, to a point.
Okay.
We don't know what the arthritis means.
Yeah, I don't know either.
It's a capsulitis primarily.
Right.
You can't go by an x-ray. You have to go by an examination. Now, if your examination is painful, that pain can be treated.
Mhm.
That's not the joint. That's the capsule.
Right.
It's inflammation of the ligament structure. So once you know what the anatomy is and what you're examining for, then you could have a treatment for it. But if you're going to get an MRI that says you need a surgery and you do it, you lost. You lost.
So,
That's
like a
not
lot
the
of
way
people
to
that
go.
have arthritis, their fingers get like funny.
Those are all treatable.
Wow, did you? Yeah. Oh, wow, that's amazing. Knowing
Yeah,
people walk
I
around.
had a basketball injury in this joint here.
Right.
Took 11 shots in it.
Oh wait, you took that
But
girl
now
that
it's
came up
normal.
that had the problem in her finger.
Yeah, treated it all the time.
Okay, Rachel from Atlanta writes, I heard on your last show that a woman carrying children in their 6th to 9th month should not be in pain. I've been a mother of 4, and every woman has pain when carrying children. If your belly is big and your lower back needs to carry the weight, I don't understand how you can tell people, with this condition that you can remove the lower back pain. How many pregnant women have you treated, and how many...
You see, it's not the pregnancy. It's a ligament structure that causes the pain. So you have to know what you're talking about. Just because you're pregnant, you don't know what that pain is.
I have to read the...
I mean, even though it's your pain, but you're not going to know what it is. I know what it is, and we treat that exactly the way we're saying. There's no reason to suffer at all. You can do an exercise for it, as long as you know where it's from. It's not the pregnancy. It's the ligament structure that's causing the pain. Remember that. It's not the pregnancy.
I didn't finish the question.
Go ahead.
Okay.
That was a great answer.
Yeah, it was a
don't you
great
think?
answer. But I didn't finish it. You were on such a
But that
roll, I
was-
didn't want to stop.
That wasn't for the question, though.
How many pregnant women have you treated, and how many actually had lower back pain removed? I'm curious.
Oh, I don't know.
You've
I've
done
been
quite-
at this for 50-some years.
Yeah.
I mean, there must be thousands.
More than one.
Yeah, more than one.
More than one.
So if you have pain, I mean, you're 90 minutes
Now,
away.
see, there's a question now. The mindset of this person who says, what can you know about it because you've never been pregnant? That is the wrong thing to think. You can't think that way.
No, you can't. I mean, we don't expect.
Well, she's
it.
probably angry because she's had 4
Yeah.
kids.
4 kids. This is number 5.
and Pannozzo wasn't there to help.
Where were you for those 4 kids? Okay.
I had nothing to do with it.
I don't want to say anything, Doc. Don't need to know. I'm happy the way I am. Okay.
Maybe an angry girlfriend.
And girlfriend, Doc. Ryan, he's funny today, huh, Doc? Ryan from Boca Raton writes, I'm a pitcher for a team here in Florida and was told my rotator cuff is injured. I've been sidelined for 6 weeks until it heals. The shot medicine in the area to reduce the pain and allow healing is not a tear but seems to be strain. There's a lot of pain in the area and it's warm to the touch. No surgery is said to be needed at this time. If I went to see you, will my healing be faster and I will be able to pitch again?
Overnight.
Yeah. That's what's scary. Doc. You know what's scary? This is someone that does this for a living, this kid. And they tell him all the wrong things. They're loading him up with medication and he could be cured. And wait, these are not, can I just say this one? These are not enhancement steroids. This is in and out of your system in what, 8 hours?
we don't even have. We have to have a source, a diagnosis first.
Right.
That diagnosis is a throwaway diagnosis. Nobody has that. Rotator cuff. Nobody has that.
Do you know they just placed Met Catcher, who he can't stay on the field for 4 years. He's been on the DL.
Wow.
He's on the 15-day DL again for that rotator cuff. A
Disabled
catcher.
list.
People watching that, you should stream the show because I'll show you how to diagnose
It is
rotator
streamed.
cuff.
It is streamed.
You gonna pitch?
Right there. That's your rotator cuff.
You see
That's
that,
what
Fred?
it
Yeah,
does.
I see it. Okay.
Yeah, it's there. But the funny thing is that he's on the DL. 6 rotator cuffs DLs last week in the Major League Baseball.
Well, they're all being mistreated because of this surgery aspect. People want to do surgery, and they don't do anything else but surgery.
We should
So
fly-
who's actually treating this guy?
The trainer.
The trainer!
Come in.
No,
Okay.
The trainer.
Well, you know what?
We should fly to
the
New
trainer is not
We
able
should.
to diagnose anything. He's not trained that way. He's trained to put an ice pack on, not to have a treatment program. Get away from that. The trainers ought to stop it themselves. You know, I mean, that's a lot of dishonesty.
You want to hear something funny? What you said in one of the fights that I saw, the guy they had strapped ice packs onto his forearm. So I guess he must have hurt his forearm from punching so much, and they couldn't even get him to talk. He was like this in such pain from punching. I mean,
That's a misuse. That's a misuse.
right.
That's an abuse.
Yeah.
That person was being abused when they put that on him instead of asking for medical advice. Wrong.
That's a trainer.
The orthopedic surgeons give them the ability to think on themselves, and it's not right.
Well, I get one more
Because
question.
why? There's no treatment available from an orthopedic surgeon. This is the truth now.
Yeah.
They're not trained to treat these things. They're trained to operate.
Oh, so that's where the word surgeon comes in.
That's where the word surgery
You know
comes
that,
in.
Fred. I just want to make sure you knew that. But it's true.
That's true. I mean, everything we say is true here. I mean,
I got one more question, Doc. Alex from West Palm Beach writes, I hear that you worked on groin pain and removed the inflammation. I mean, I should get some. I've doctored that. That was causing discomfort. How long did it take for him to get back to normal?
who?
Me.
Yes.
You.
Let me
One
stop.
day. One day.
Well, it was less than one day. I was at the gym the next day. How long did it take for him to get back to normal? Did the pain return? I have lower back pain from lifting a heavy box incorrectly. I also seem to have hurt my groin area in 2 places and want to know if each area is treated independently or is this something that's happened because of my lower back. Let me answer my part. I was okay within maybe 10 to 15 minutes of the shot. I was 100% cured. When I woke up in the morning, I was at the gym doing squats, and that was over a year ago. And then came back. So I guess that's the best way. Now, you take your part of this.
Every pain source is treatable in one day. You have to know. But you have to know other things, too. You have to know cause and effect. You have to know the engineering of it, how it's made, what happened to the design and function. You have to see that's how you think about these things. And then you can come out with a terrific treatment for it, like one day.
I mean, is your success the same, Paul? One day for groin pains?
Well, sure. It depends on the diagnosis.
Yeah.
It sounds like you had a hip flexor, which is an easy fix.
I don't know. Whatever your dad did was over a year ago, and I still have no pain at all. Not even a twinge.
And he has an old hip flexor.
Right. Yeah,
I mean, that's amazing. It really is.
Some reasons for groin pain are easier to treat than others.
Yeah, I can see that.
Yeah, they're all
But,
pretty
for
fast.
tendons, ligaments, absolutely. As long as we get the right place, but history and exam tell a lot. Don't really need. You don't need imaging to. A lot of the time to move forward with somebody, you can always help them out, even just on the initial visit, without any imaging or any delay. Most there are places that can be helped, and only if there are some lingering things, maybe does imaging need to be obtained. But for the most part, yeah.
Well, it's getting to the end of the show. Paul, where can people contact you in your area?
623-776-8686.
And you do the same thing as your father, which is commendable. Paul, thank you so much for coming on and sharing your knowledge
See you
with
later,
us.
Paul.
Hey, Paul, you ought to see the car he's driving now. Pretty good. Doc, I want to thank you, as always, for being here. And if people want to contact you, they go to 561-381-5800. And my feeling is this. I'm going to tell a quick story. We know someone that, because of insurance, would not let her go to see the doctor. Okay? She was just let go from her job from overuse of pain medication. So.
Oh, that's too bad.
Yeah. Okay, guys, time to wrap up with another Sunday. Paul, go back to sleep. If you want to talk to the big guy, 561-381-5800, and please.
Thanks for listening, guys.
Thank you so much. We'll see you next Sunday. Godspeed.
This has been the Dr. Pannozzo Sports and Medicine Hour with Dr. Anthony Pannozzo. If you spend 5 minutes with Dr. Pannozzo, you'll see he genuinely enjoys helping others. Visit Dr. Pannozzo online at www.paincentersnationwide.com or call him at 561-381-5800. Dr. Pannozzo will consult with you to determine the best solution to your pain needs. 561-381-5800 is the number to call, even if it's just for a second opinion. Join Dr. Pannozzo next week when he brings you more important information on the physics of weight-bearing and engineer concepts for the body.